This weekend will mark 2 years since the coronavirus appeared in Idaho. Local News 8's Rachel Fabi talked with a couple of our healthcare heroes at Madison Memorial Hospital in Rexburg about what the past 2 years have been like.
The early days of COVID, it was kind of, you're hearing this rumbling of something happening in China and not really thinking that it was really going to get here. And then it started hitting the United States and hearing stories out of Italy and out of Oregon and New York and, hearing very bad respiratory illness and people dying on ventilators and our normal treatments not working.
We hear of these things and it never comes to the forefront or comes to Eastern Idaho. And so we were a little skeptical in the beginning, but as soon as things started coming to the United States, that was when we really started to take a step back and look at what we needed to do to prepare as an organization.
Idaho was the second to last state in the country to report a confirmed case, but that time allowed our health officials to talk with other hospitals and form a game plan.
Number one, this is a virus, so antibiotics weren't going to help for it. But number two, we learned very quickly that giving these patients a lot of fluid was the absolute wrong thing to do. So fortunately, we didn't have to make that mistake.
One thing that worked.
Most of the time when we have someone with pneumonia, we're having them on their back and sitting up. And for these patients laying flat on their stomach, they did much better, which didn't make any sense, but it worked for COVID patients.
At the peak, the ER at Madison Memorial was seeing up to 40 COVID positive patients a day. And one big thing helped bring that number down.
If people would get the vaccine, there was very low chance of them being admitted to the hospital. It was like less than 5%. And we did not have any deaths in our vaccinated patients. So, the vaccine was a big change.
And there are more options when it comes to treatment.
The monoclonal antibodies, polyclonal antibodies, a couple different versions came out of things that people could get that could prevent them from having to be in the hospital. Now there's even some pill form options. Paxlovid is a new medicine out there that if people get it within the first 5 days, it can slow down the symptoms and prevent them from having to come into the hospital. From the early days of having 2 medicines that we could use, now we're up to about 4 or 5 different medicines that we can use in the hospital settings.
In Rexburg, I'm Rachel Fabi.